How to use automated external
Seconds are of the essence when dealing with a sudden cardiac arrest situation. Knowing how to properly use an automated external defibrillator, or AED, when the opportunity presents itself can save a life. An AED is a portable device that analyzes the heart's rhythm and can deliver an electric shock to restore a proper heart rhythm. You've likely seen one around your workplace or out in the community. When you come upon someone who you think may be suffering from sudden cardiac arrest, you should first check for signs of life. Give the person a tap on the shoulder and ask if they are okay. If there are no signs of breathing, assume that the person's heart is not functioning properly and have somebody call 911. Start using the AED immediately. If an AED isn't readily available, administer CPR until an AED arrives. Once you have the AED in hand, turn it on and follow the visual or audio prompts. The AED will tell you what to do next.
Connect electrodes.
Open the person's shirt and wipe their bare chest dry if necessary. You may also need to quickly shave the person's chest with the razor provided in the kit to ensure the AED works correctly. Apply the pads to the person's bare, dry chest. One pad goes on the upper right chest, the other on the lower left side. Some pads have illustrations to aid you in placement. If the AED doesn't start analyzing automatically once the pads are applied and cables are connected, plug in the connector. Push the Analyze button and allow the AED to analyze the person's heart rhythm. It is important that nobody touches the patient while the AED is analyzing so it can operate properly. If the AED recommends that you deliver a shock to the person, again, make sure that no one is touching the patient, including yourself. Tell everyone to stand clear and press the shock button. Once the shock is delivered, or if no shock is advised, it is safe to touch the patient. Begin CPR. Give 2 minutes of CPR before analyzing the heart rhythm again. If you notice an obvious sign of life, stop CPR and monitor the person's breathing. When in doubt, continue CPR and follow the AED's prompts until medical help arrives. The AED will direct you through each step of the process. We hope this video helps you feel more comfortable in the case that you have to use an AED. Your knowledge and quick action could save a life.
How to find unconscious casualty. See the image. Airway blocked by tongue. Airway clear. Recovery position. A. With the person lying on their back, kneel on the floor at their side. B. Extend the arm nearest you at a right angle to their body with their palm facing up. C. Take their other arm and fold it so the back of their hand rests on the cheek closest to you, and hold it in place. D. Use your free hand to bend the person's knee farthest from you to a right angle. E. Carefully roll the person onto their side by pulling on the bent knee. F. Their bent arm should be supporting the head, and their extended arm will stop you rolling them too far. G. Make sure their bent leg is at a right angle. H. Open their airway by gently tilting their head back and lifting their chin, and check that nothing is blocking their airway. I. Stay with the person and monitor their condition until help arrives. Stop the flow of blood. Wear gloves. Cover the wound. Apply pressure. If a body part has been amputated, put it on ice. Shock. A. Check response. B. Lay the person down and elevate the legs. C. Call to ambulance. D. Keep the person still and don't move him. E. Cover the person with a blanket to prevent chilling. F. Don't let the person eat or drink and drowning. 1. Get help. Notify a lifeguard, if one is close. If not, ask someone to call 911. If you are alone, follow the steps below. 2. Move the person. Take the person out of the water. 3. Check for breathing. Place your ear next to the person's mouth and nose. Do you feel air on your cheek? Look to see if the person's chest is moving. 4. If the person is not breathing, check pulse. Check the person's pulse for 10 seconds. 5. If there is no pulse, start CPR. Carefully place person on back. For an adult or child, place the heel of one hand on the center of the chest at the nipple line. You can also push with one hand on top of the other. For an infant, place 2 fingers on the breastbone. Types of wounds: A. Contusion. B. Abrasion. C. Laceration. D. Incision. E. Penetrating. F.
Word amputation is used to describe an event when a part of the body has become detached or removed from the body. A finger that has accidentally been cut off from the hand is an example of an amputation. If an amputation occurs, DRS ABCD and call 000. Use standard precautions and wear gloves. Then you'll need to follow these steps. 1. Manage the bleeding wound by applying pressure and elevating it. 2. Locate the amputated part or parts. 3. Place the body part into an airtight container or sealed plastic bag. 4. Place the sealed bag or container into ice water, making sure the body part does not come into direct contact with the water. You'll need to ensure the body part goes to the hospital with the casualty. And finally, you will need to manage the casualty's shock.
Fracture. Signs. The 7 things to look for are: 1. Swelling. 2. Difficulty moving. 3. Movement in an unnatural direction. 4. A limb that looks shorter, twisted or bent. 5. A grating noise or feeling. 6. Loss of strength. 7. Shock. Type of bone fracture you can see. Types of fracture. 1. Impacted fractures. After a heavy fall, the fracture may be impacted by the force, e.g., spinal injury falling from tree. 2. Pathological fractures. These occur when the bone is weakened by loss of calcium, infection or cancer. Minimal cause a break in such cases. In old age the bones are more brittle, and may break spontaneously due to calcium loss, which is part of the aging process. 3. Stress fractures. Stress caused by repeated minor trauma, as in athletic training. Involved in strenuous training, such as jogging. Fracture, first aid. If it is an open fracture, cover the wound with a sterile dressing and secure it with a bandage. Apply pressure around the wound to control any bleeding. A. Support the injured body part to stop it from moving. This should ease any pain and prevent any further damage. B. Once you've done this, call medical help. While waiting for help to arrive, don't move them unless they're in immediate danger. C. Protect the injured area by using bandages to secure it to an uninjured part of the body to stop it from moving. For example, fractures on the arm can be secured with a sling, and a leg with a fracture can be tied to the uninjured leg. D. Keep checking the casualty for signs of shock. This does not mean emotional shock, but is a life-threatening condition, often caused by losing blood. E. If they lose responsiveness at any point, open their airway, check their breathing and prepare to treat someone who's become unresponsive. Type of